Hi, everybody. We're going to go through the first component of the risk-based monitoring technology module, which has to do with 21 CFR Part 11. So let's get started. Well, maybe we'll get started. There we go. So although this says monitor, as you know, for our organization, everybody needs to be trained in 21 CFR Part 11. So, but for this, why does the monitor actually need to know about that? And the reason is that you need to understand 21 CFR Part 11 and how it affects eSource, eDiary, ePro guidance, I'm sorry, I said that wrong. So that you're going to understand the requirements of 21 CFR as well as the eSource, eDiary, ePro guidance, and how these requirements affects the monitor's role. For today, we're only going to focus on 21 CFR Part 11. The second component will be in a separate recording. The reason for this is to understand the importance of role-based access and technology systems in protecting personal health information, to be able to describe how to convert a document to a certified electronic source. Monitors will be able to describe technology requirements that are needed to review and manage data and documents in electronic systems. And the monitor will understand what reports need to be generated for study, site, and subject monitoring and data review purposes, and how to create those reports. Now, that last one will not be part of this specific recording. So one thing that you've probably noticed when you looked at the new ICH guidelines, we know that the FDA guidelines on risk-based monitoring focus on the importance of technology and how that can enable you to do much more remotely. And the ICH guidelines, even for good clinical practice, even go farther, and they spend some time talking about the importance of validation of software systems. So there are a lot of different software systems. These are just a few of them that are important for data capture. So we have our old friend EDC, or electronic data capture, electronic source, and that's different in that the data, the primary source, or so the primary first time that data is recorded is done in the eSource. So we see that in a number of different ways. Sometimes the electronic health record is considered the eSource, but oftentimes for trials, when you can do direct data entry, that document then is considered the source, where so that there's no moving from paper to an electronic system. E-diaries are another very important way, and for many different studies, this is one of the primary efficacy or primary safety endpoints. The same way with electronic patient-reported outcomes. So these are often things that you might see, like a quality of life instrument, I think I would consider the Columbia Suicidal Index as another one that's a patient-reported outcome. So these ePro are usually validated tools that are used to look at patient outcomes. Then there's the IVR or IWR systems, which many of you are familiar with, where oftentimes you get your randomization numbers. And then there are integrated safety and clinical databases, and of course the electronic health record. These are just a few, but these are the common ones. From a document standpoint, many people know about an electronic trial master file, which is where you can maintain all of your, basically the sponsor reg binder in an electronic format. But there's also the opportunity to use an electronic investigator site file, or EISF. And in there, not only can you include all of the site's regulatory documents, but because of role-based access, which we'll talk about later, you can also collect personal documents that contain personal health information, such as the signed informed consent, source data, in the EISF as well. So it allows you to do remote review of documents, not just data. So what other technology is available? Yes, there's portals. There's e-consent, which is getting more and more interest because consents are one of the top five findings at site audits. Clinical trial management systems, these are often systems that either a CRO will have or a sponsor will have that let them have a visibility into what's going on at across all the assets for the company. Clinical data warehouse or data repositories. And for us in our risk-based monitoring, this is a critical piece of our approach. And then many reporting tools. So there's JReview, which we use. Spotfire is another reporting tool, and ClickView, which we also use. And of course, Excel. You can't forget Excel because Excel does allow you to run reports as well. Now, oftentimes, monitors have traditionally left these electronic systems to others, and so they've said, "Oh, well, it's the EDC system, so data management takes care of it." But there are real reasons for monitors to understand the software that you're working with, and among these are that each system has its strengths and weaknesses. So if you don't know what your system is doing and checking, then you don't know what you need to do otherwise. So if you think that there are certain edit checks that are in there, you need to know those what edit checks are in there, what checks the system is doing, because that may affect what kind of monitoring review that you need to do. And so understanding what your systems can do and what they can't do is another really important component. Sometimes it's important when you're choosing a system, but often just to know what the system is actually able to do. And each one of those systems will affect how you do your job, how you will monitor, and how you will review and analyze data. So it's absolutely critical for monitors to understand technology. And technology is guided by specific regulatory requirements. And the one we're going to talk about today is 21 CFR Part 11. And so what is that? So first of all, we've spent a lot of time talking about things like risk-based monitoring guidance, but this is not a guidance. This is an actual regulation. So this is not a, do you really have to follow it? This is, you do have to follow it. And it regulates electronic systems used in clinical research, and it includes specific requirements for the use of electronic signatures, how to generate a certified electronic copy, audit trails, and data access controls. And some of the jobs that you do as a monitor will take advantage of all of these different components, which is why you really need to understand them. And some of the things that you do as part of your monitoring you may not have realized up until now is related to these regulations, so 21 CFR Part 11. One of the important pieces here, and it's a trick, but you need to know it, is that 21 CFR Part 11 talks about both system requirements, or what does the technology need to be able to do, but also associated processes. So it's important to realize that you can't have just the system without the processes that go along with it. And it applies to anyone who is going to maintain their records or submit records electronically. So all of your EDC data would be a place where it does require that meets 21 CFR Part 11. It applies to any records in electronic format that are created, modified, maintained, archived, retrieved, or transmitted under any records requirements set forth by the agency. So it's much broader than just the FDA, but for us, we need to know that it's for the FDA. So here's a question for you. If a vendor states that their system is 21 CFR Part 11 compliant, is that a true statement? So who should I pick on? Garrett, I'll pick on you, if you want to go off mute.
So if they just say, or there has to be documentation, right?
right? But can they say that their system is 21 CFR Part 11 compliant?
No.
That's exactly right. And the
Um,
reason for that is because, can you tell me?
so I don't because I don't I no I really can't.
That's okay.
Why
Uh,
can't they?
so the reason is you have to have both the system requirements and the processes. So if you just throw a system but you don't follow the requirements, and we'll go through these in a minute, but one of the key requirements is that everyone is trained on a system. So you can have an EDC system that is designed with all of the requirements for 21 CFR Part 11, but if you don't include training and defining who can have access and what they can have access to, then you have not maintained the requirements of 21 CFR Part 11. So it's important to realize that it's not just the system, but the processes that you tie that go along with it. And from a
So their
monitoring
system can be
standpoint,
only if they have the processes.
pardon me?
So their system can be compliant if they have the processes, right?
Exactly, but you
Too?
but you can't say a system is compliant. It's kind of a trick question. So it can meet all of the requirements, but if you don't tie in the right processes with it, then you're not 21 CFR Part 11 compliant. So that's why it's really important. And the process piece is where the monitors can play a really, really important role. Not totally, but it a lot of what the monitors have to do is associated with the processes that for 21 CFR. So here's the answer. It's not possible for any vendor to offer a turnkey Part 11 compliance system because you have to have both procedural controls. We just talked about a few of those: notification, training, SOPs, and administrative controls to put in place so that in addition to the technical controls. What can a vendor offer? Well, a vendor can offer an application that contains the required technical elements of a compliance system. So, for instance, when you ask a vendor, do you have a full audit trail? Absolutely. And it has to be an audit trail that is human readable. So it has to be something that you can go in and look at. That is a key component of a system. And yes, a vendor can make sure that their electronic systems do have an audit trail. And that's what you want to ask them. So specific components that they need to have, you want to know that they have those, but it's not over yet. So 21 CFR Part 11 applies in several places. One, anytime you use electronic records in place of paper in a regulatory submission. So like we talked about, the electronic CRFs, that is a place where 21 CFR Part 11 applies. Whenever records for regulated activities are maintained both electronically and in paper, then 21 CFR applies to the electronic format. And anytime that records are submitted to the FDA in electronic format, 21 CFR Part 11 applies. Whenever you're using an electronic signature that is the equivalent of a handwritten signature, then you need to maintain and use 21 CFR Part 11. And anytime an electronic system governs specific processes, so for us, we aren't working in GMP, but we are working in GCP. So anything that we have to do with maintaining GCP in electronic format, then 21 CFR Part 11 does apply. And what you're wanting to do here is to make sure that there's data integrity, so that when you take that data in the electronic format, you can trust it, and that you can access that and view that data for years to come. So that's another important piece. So that's why you have consistency, accuracy, reliability, and it's not just the content, but the processes and the systems are all critical components of this. Now, the predicate rule is the 21 CFR Part 11 refers to the predicate rule. And the predicate rules are any FDA regulation that requires company to maintain certain records or submit information to the agency as part of compliance. So if you are in manufacturing, it would be documentation for the manufacturing, packaging, and label of the IP. For clinical trials, it would be among other things, it would be the electronic data capture systems, but it would also be any systems that are used to collect and maintain documents. Any documentation related to predicate rules that is maintained in electronic format is also subject to 21 CFR Part 11. And if there are no FDA requirements that a particular record be created or retained, then 21 CFR probably doesn't apply. But because we're focusing only on the areas where we do want to focus on 21 CFR Part 11. So let's start with the electronic signatures. So if I log in using this is a little bit tricky. So Christine, I'm going to hit you up for this one. If I log in using my username and user ID and password, have I met the requirements for an electronic signature?
I'm wary of your trick questions, Penny.
Well, I gave you a hint that it was a trick, but that's okay. Whatever questions you answer wrong, know that everybody that listens to this video will also probably miss them too. So
let's see. Okay, so if I log in with the user ID and password, does that meet the requirements? I think that no, you have to have it. I don't quite know how to answer it.
There you go. You got the no. So you didn't quite get why, but that's okay. You got the no. And that's because the user must indicate intent and meaning of the e-signature. So and this is important because we use this when we do our certification of electronic, making certified electronic copies. You have to have some kind of attribution, some kind of attestation language. So I certify that if this were EDC, that I have reviewed this data and it is correct. Okay, it could be if we're doing certified electronic copies, I certify that I have compared the paper and electronic versions and they are the same. So it is important that you have an intent and meaning to the e-signature. It's not just an e-signature. There's a reason for it. And you really need to re-enter your username and password to show that you are executing a signature. So for instance, most electronic systems where you do have to put in an e-signature, once you've logged in, sometimes you only have to enter one of the other. If after you've done the first e-signature, if you have multiple ones in a session, you may just need to enter one piece of one of the two forms of identification, but there are requirements that you must enter the username and password to show that you are executing that signature. And every signed electronic record should include the printed name of the signer so that you can read it, because we know that that's actually a real benefit compared to wet ink signatures where you don't know, the date and time the signature was executed, the meaning associated with the signature, and although it's not in here, we think that it should be tied to the document. In other words, that you can't just have an e-signature kind of off on its own. You really need it tied to the document where that e-signature actually occurred. Okay, we talked about that you have to have two distinct identification components. So that's usually your username and password. You can use other kinds of identification as well. Items are subject to the same controls as electronic records. So anything with electronic signature must meet the 21 CFR Part 11 compliance. It must be included as part of the human readable form for the electronic record. So that's why we talked about it when it's printed out, that e-signature with the name and the date and time must be included and attached to the respective electronic records. So are these signatures acceptable? So, I'm sorry, I did not get the worksheet for you, so you get a pass on that. So notifying the FDA about the use of e-signatures. So in 21 CFR Part 11, they require that every organization send notification that they intend to use electronic signatures. Now, they don't have to do it for every trial or every project, but every organization must send this letter documenting that they plan to use it, and that they are saying that the electronic signature is the binding equivalent of a traditional handwritten signature. Now, another big piece. So, any questions up to now?
No, but I didn't know about that FDA notification. That's
Well, I
interesting.
think many people don't. So one of the things that
Mhm.
we do is at the beginning of a study, we always send those out just to be sure that unless the sponsor knows that they have had it sent out, then we'll send it out just to make sure, because we want to make sure that everybody's covered. Now, from a definition standpoint, there are two different kinds of electronic systems. There's an open system, which is an environment not controlled by persons responsible for the content of the records. That would be something like Google or um, eBay. Okay, so as opposed to a closed system where it's controlled by the people who are responsible for the content of the electronic record. So this would be like the EDC systems that we design, or any of the systems that we use. I would say almost any of the systems that we use. I wouldn't say any, but almost any of the systems we use for clinical trials would fall under closed systems. Another difference is the difference between a digital signature and an electronic signature. Now, the FDA does not require digital signatures. An electronic signature is sufficient. So, a digital signature requires some kind of cryptographic method for confirming the identity of the signer. And there are certain companies that have, like, I'm trying to think, is DocuSign? No, not DocuSign is not one. That have specific digital signatures, but otherwise, but for most of the EDC systems and many of the other places, we use an electronic signature, which is a data compilation of any symbol executed and adopted or authorized by an individual to be the legally binding equivalent of the handwritten signature. So this is less restrictive than this. And this is acceptable. So you will often have somebody go, "Oh, I have to have a digital signature." Well, unless it's in the SOPs, you do not have to have you do not have to have a digital signature for documents going to the FDA. So let's talk about control, because remember we talked about open systems and closed systems are those that have aspects of control. And here are some of the things that you have to include. Is the record required by the predicate rule? Of course, that's important, because if it's not, then you don't have to follow 21 CFR Part 11. Is it a regulated activity dependent on the record? Yes. So that's why making sure that even things like reports, because if you're going to make decisions on those, you need to make sure that you can document that the reports were correctly designed and developed as well. What is the company's business practices? Because those are important as well. Again, that's getting to SOPs. And have operators or supervisors access to data? Can they change the data? And can such data impact product quality? So this is really important, and we'll talk some more about this, is the role-based access. Who can access data? Who can change data? So here's some of the evidence. And these are really important. So validation, as you know, in our organization, we spend a tremendous amount of time on validation, making sure that the systems that are released have met the requirements of the specifications, and that's the validation part. That's the importance of the testing that you guys do and the documentation of the testing. Generating accurate and complete copies is another really important evidence of control. So being able to document that, so if you want to think about that, let's take something like a CRF page that you want to be able to make a PDF of that. That would be evidence of control. protection of records. So who can access the records, and making sure that you document that people have met the requirements needed before they're able to access. Records must be protected to enable their accurate and ready retrieval throughout the record retention process. So how are these data being protected? Limiting access to authorized individuals, using secure computer-generated time, date, user audit trail, and that's a really important one. And we'll talk a little bit about audit trails here. We've talked about it in some of the monitoring components of how valuable an audit trail can be. And use of operational system checks to enforce permitted sequencing of steps. So, for instance, that if you do have, let's just say, randomization integrated into your EDC, and that you require that the sites confirm that, let's say, all the inclusion criteria were yes and all the exclusion criteria were no, and anything else that needs to be done was done before they can actually randomize a subject. So this is where that, using the system capabilities to enforce a specific sequence of steps. Authority checks are another way, making sure that the right people do the right things. And again, device checks. So is the device working correctly? And determination that persons that develop, maintain, or use these signature systems have the education, training, and experience to perform their assigned tasks. And that's where the education piece comes in, and the training. And that's an absolutely critical component. And that's a very important part of the monitor's job. So if you have people using electronic systems and you haven't documented that they've been training, you are not in compliance with 21 CFR Part 11. Again, establishment and adherence to written policies to hold individuals responsible for actions under their signature. Oftentimes you may have some companies will use a document that says, this is my username, and I've been given a username and password. I am not to share it with anyone. I am to only use it. Those are the kinds of reasons that you want to put those policies in place. Sometimes they say, I'm acknowledging that I know that my electronic signature is the same as a written signature. I think you're seeing less and less of that now as people are using more electronic signatures. And adequate controls over documentation for system operation. So again, the specifications you have, the testing you have, the release, all of those controls of the validation and documentation for the systems are important. And a really important area is change control processes. So whenever you change the system, you need to make sure that whatever you did didn't break what you'd already had within the system. So change control is a really important piece, documenting what you did, documenting that it had the changes you made were as specified, but also that you didn't break anything else as part of that change control process. So accurate and complete copies are a really important piece. So we talked about that as one of the controls. So how do we make adequate and complete copies of EDC? Do you know?
By archiving?
Right. In your archive, you will have a PDF of all the EDC, and it should include the audit trail, and it also should include the query trail, because you want to make sure that data, if it changed, why did it change? You want to look at not only the copy of the EDC, but the audit and the query trail. eSource, same way. You would do the same kind of archiving with audit trail and query trail. Paper source, how do you make an accurate and complete copy?
A certified copy?
You could make a certified copy if you wanted to convert it to electronic format. But really, paper source is problematic because people can add information into the paper source and write it in and it not have a date time with it. You don't know who really did it. So in many ways, by moving to electronic systems, we're able to keep much better understanding of what happened during a trial and what to do. Informed consents. Um, again, Christine, making a certified copy, a certified electronic copy is a great way to keep a copy. Otherwise, the old-fashioned make a paper copy is fine. The worry is, do you have them all? And I think that's why you so often see these um, findings on audits, is that they can't find the paper informed consents once people come back to look at the data. Same way with an EISF. Again, you want an archive of that so that so that you can confirm it. The same with IVR and diaries. So you want to make sure that you have human readable copies with the audit trail and query trail with that. And so how do you protect these? Again, there's lots of places you do that. So one of the ways you protect it is, in the old days when you had paper, you did what? How did you protect it in the paper world, Christine?
Put it in a fireproof room.
Exactly, and it's usually locked. So records were not available for people to just come and view. They were locked up, and that has many challenges, as people know, when somebody goes in and looks at the records and may not bring them back or whatever. So, but with protection of records, you want to make sure that you are thinking about how do you protect it from an access standpoint, who's supposed to be able to maintain that. But when you have electronic records, oftentimes it's less difficult because they're smaller. So you can lock up a disk as opposed to having a whole file room to have to lock up. And what do you need to protect? The guidance allows converting records into different formats. If you want to put it into paper, microfiche, standard PDF files, DVD, as long as the new format can be used to preserve the content and meaning and demonstrate compliance with the predicate rules. So that's why we believe that using the electronic methods, usually putting things into PDF because they can't be modified, is our preferred method. Now let's go to role-based access, because you guys hear me talk about it all the time. I think it's such an important piece, and it really affects what you can do with different systems. So sometimes you'll hear role-based access, sometimes you'll hear roles and privileges, but basically what you're doing is you're assigning to individual users or groups or roles what they need to be able to do based on their responsibilities for the trial. So, and usually this is defined by and or approved by the sponsor. So if you're working with a CRO, they may put it together, but there's usually a final approval by the sponsor. And this goes at the 21 CFR Part 11 requirement that only people that are supposed to get into the system, that have a reason to get into the system, are able to get in. And what you'll see often is, can they read this document? Can they enter the data? Can they modify the data? Can they issue queries? Can they close queries? And can they sign? And although this one says sign our CRFs in specific pages of the CRF, we know that when we're doing things like making certified electronic copies, it's not just signing the CRF. It could be any document that you want to confer. So just so that we're clear, who usually signs the CRFs?
The PI.
The PI. And what specific pages of the CRF do you sometimes have an electronic signature on?
Study close end of study.
Yeah, there's another one. If you have an SAE, oftentimes you'll require the investigator to sign if there's a serious adverse event. Those are just a couple, but they can be put anywhere. So we had one sponsor that wanted the investigator to sign off before randomization. So they can be put anywhere, and in most EDC systems, The sign-off is usually limited to the PI, but that's an area to really ask about because depending on the system you're using, sometimes you want people other than the PI to have the ability to sign off. All right, so this activity takes a while, and but let's just do a couple of them. So the site monitor, let's just think about for the CRF. What is the site monitor usually able to do based on these up here?
Enter queries, issue queries, close queries.
Yep, that's it, right? They don't, and they read the data, right? So they have read only, okay? The central monitor would be probably the same thing, right?
Mm-hmm.
Depending, some people don't want, they only want the site monitor to raise queries. So this would depend on specific processes within the organization. How about the data manager? Garrett, I'll give this one to you. What is the data manager usually able to do? Oops, sorry.
Close queries, issue queries, determine what pages can be seen, maybe even sign the CRF.
No, they won't usually sign the CRF, but they would do all of those. You're absolutely right. Because sometimes you want pages only seen by some people and not by others. So now if you're a study coordinator, what can you do?
Enter data, modify data.
And usually not sign off, because again, that's usually the PI that does that, so the investigator. And then people like the statistician, all they can do is read data, and they usually don't get into the EDC at all. So most of the people from the sponsor side do not ever touch the data. They're not ever able to enter the data. And depending on their role, they may not even be able to see certain pages. So here's one of the ones that, if you remember nothing else from this, I hope you remember a little more than that, is the idea of adequate and appropriate training, that every system, it is required that all the users be trained and documented. That's why we put our training records there, so that we can make sure that we have documentation that everyone was trained. And any of that documentation of training must be stored in the EISF or ETMF. Since we have a specific document that we maintain that usually in a different database, but regardless, it'll ultimately be stored there to show that the users of the system have been appropriately trained. And among that, you want an explanation that electronic signature is equivalent to a wet signature, and that training must include both system training and study-specific training. So oftentimes, we'll combine those. Some systems have a separate system training, and then you do the study-specific training too. But I find that if you can combine them, oftentimes it's easier for people to really understand how the system works if they do their system training and study specific training together. It's not a requirement, but what your goal is that the users really know how to use the system and are able to do that efficiently for their trials. And as we mentioned, this operational checks is another important thing, so that FDA regulated computer systems should have sufficient controls or operational system checks to ensure that users must follow required procedures. And so here's one. This would be if a computer system regulates the release of a manufactured product, the computer system should not authorize the release until the appropriate quality approval has been provided. For us, it would be things like randomization. So when we do that within the EDC, you want to make sure that all the right questions have been answered. The same with IWRS. The study's subjects should not be randomized until all the randomization criteria have been checked as having been met. Those are the kinds of operational controls that we're talking about. For ePro, it could be things like the subject must enter a unique username and password to enter their data into the ePro. And once the electronic signature is attached to a completed e-parole or an EDC, it can no longer be modified unless the electronic signature is removed. So that's another really important workflow and operational check. Now, my favorite is the audit trail. So why do I love the audit trail? What is an audit trail first? So it's a computer-generated chronologic record of what's been done within the electronic system, and it includes the date and time of the entries, what happened, who did it, if there was a change in the data, why was the data changed? So all of these pieces, so that when you go to the audit trail, you can replicate and understand exactly what happened on that page. And if it's a better system than the older paper-based systems where you drew a line through a specific field and then initialed it, this is giving you much more information, and it tells you a lot about what actually happened within that system. So that creates an audit trail is typically required to run in a privileged mode so that access and supervise all actions, so that it can access and supervise all actions from all users. So the important thing there is you can't change the audit trail. And really, only in rare situations that are fully documented should the audit trail ever be changed. And so in general, this is what happened within the system. And it says here the trail should not be accessible to normal users. Although I think that really limiting access to the audit trail is not as frequently used, and I'm not sure that that is has to be done this way. Again, if it's for the subjects, they would not normally see that. But the audit trail from a monitor standpoint is an absolutely critical function, as well as for the data managers. And these are some of the rules that you have to have. Changes cannot obscure previous entries. That means you can see what happened the first time and any changes that are there, that you can see each instance of a change or is available, that the records can be read in human readable format so that they don't require some fancy permutation to be able to do. It's good that they have the ability to search or sort or trend copies sent to the agency if this is possible within the original record. So again, the FDA will be looking at things like how often did a critical endpoint change? Okay, so as you're thinking about that, how often does a critical endpoint change? Is it something you're seeing on a routine basis? And audit trail documentation must be retained for a period at least as long as that required for the subject electronic record. So that means that's giving you the confidence that the data that you have, you know that how it got there, you know if it did change, why it changed, who changed it. And again, if you're thinking about it from a monitoring standpoint, if you're seeing consistent changes on efficacy endpoints, that's a worrisome thing for you. When does it start? So for data, if you are generating, retaining, importing, or exporting any electronic data, the audit trail begins the instance the data hits, for instance, the EDC. For text, if the document is subject to approval and review, the audit trail begins upon approval and release of the document. For e-signatures, it's on execution of the document. So let's talk about some specific examples of audit trails. For eSource, you expect to have contemporaneous data entry, okay? So meaning that you enter the data at the time you saw the subject or whatever it was that you were doing. So one of the places that you would use the audit trail here is to look at a report of, say, the visit date and the date of the data entry. Because if your date of data entry is after the visit date, that's telling you that they did not enter the data contemporaneously. And you need to start looking for a piece of paper someplace. The second one is the monitor. And so that's one way you'll use the audit trail. Another would be, let's just say that the monitor says that they reviewed all the subject data in the EDC, but when you go in, you see that the monitor never accessed data for certain subjects. And it depends. Not every electronic system allows you to look at just when somebody accesses a record. Some of them only collect data when there's a change in the data. So that's another important question to ask when you're looking at the electronic system is, does it record anytime anybody opens that CRF to look at it, or only if they do something like raise a query? And the other thing is that audit trails can signal the misuse of a system or evidence of incomplete review. So we just went through some very good examples there. So I find the audit trail extremely useful in understanding what people really did. And that is it for 21 CFR Part 11. The rest we'll go through in a separate training session. But do you guys have any questions?
Not at this point. That was really informative.
Well, and it is something that traditionally monitors have stayed away from, and now you understand that audit trails can be your friend, and they can really give you a lot of insights into what's going on. So thanks very much, and you guys are now good to go for 2 more years, and I appreciate your attention. Take care. Thank you.